Assalamu alaikum. In the previous class, we discussed about the ESMO examination. Now, in the 10th September, MRCP SCE examination happened, and what is this based? Is mainly the MCQ based, based of 5 questions. So, what's the main point of that is the amount of money. In Bangladeshi taka, it's around 1,42,000 taka. Means 1,42,000 taka for exam. You have to give a exam for around 3 hours, like the MRCP type, and single paper. And if we got the past exam, this is like the MRCP that they have the average number 62 to 65, and then you will get the certificate. But unlike the MRCP, what's the MRCP SCE they call that you cannot use the MRCP SCE in your professional designation, but we always do. So what the preparation for the MRCP SCE, what we should look for? For this, I have found 2 specific books. One is SCE for Medical Oncology MRCP. This is the book. This is the cover of this book. 500 single based answer for the medical oncology, especially certificate exam, and that they have almost covered all the syllabus. Like they have the most question on acute oncology, scientific basis of malignancy, and then the another thing that after the examination I found that could be the most useful, but unluckily I didn't subscribe it before the exam. That is the study PRN. Study PRN provides the most updated or most practicable, like the MRCP. We have past test or the eWorld or many things, but for medical oncology SC we don't have many things. But for the study PRN is almost like the past test, and I can see that the syllabus, that is acute oncology, breast cancer, this one of the most covered topic, but they have also most questions on colorectal cancer, clinical research, also lung and thoracic cancer, and others that got the pharmacological part, and so scientific basics of malignancy, systemic therapies and palliative care, systemic anti-cancer. But you have to answer all the questions. But when I see that's almost like the number variations, that they have few more questions on systemic anti-cancer therapies, few more question on lung and thoracic cancer, but they have less question on head and neck cancer, because the radiotherapy is the most important treatment part of this. But they have less question on the renal cancer, they have less question on urothelial cancer, like that. There is only 6 question, or uterine cancer less question, but more question on lymphoma or lung and thoracic cancer, unless. But we don't in our practice lymphoma, but we have to face few question on lymphoma. But and also there is more questions on colorectal cancer, that you can see that in questions. So I think for the preparation of the MRCP SCE medical oncology, you should go for study PRN. That could be a great things to prepare for. And also I want to go through the study PRN. So if you want to go through some of the questions, like this is the front page of study PRN. So if you want to go through the breast cancer options, let's see. So these are the questions, and what they did was you have to, this is like the almost like the past test. So if we give the any answer, that's like 50 years old woman has an invasive ductal cancer, Trucard biopsy, suspicious mass, annual mammography at a mastectomy, regional lymph node dissection, tumor at a growth 3 millimeter with the nodal involvement, MRD. So it could be 1 to 3 millimeter. And what is the stage of this? This is the maybe the easiest question. We know that the below 3 millimeter or equal to maybe T1. So I give the answer T1. So if I got them marked, then no, it is T2, because breast cancer staging involves primary tumor, and it is T2 and 0 defines tumor between 20 millimeter to 50 millimeter. So below 20 millimeter it is T1, and 50 millimeter is T2. So this is, and the most interesting part is it gives the reference. It gives the reference AGCC cancer staging manual reference, and also NCCN clinical practice guidelines. So if I got this wrong, you can go through the NCCN guideline. But I have a few questions like this, where they give reference from ESMO, they give few reference from NICE, but from another examiner of the MRCP, this from Pakistan, she said that that the NICE guideline could be the perfect guidelines for this MRCP exam. But in this study PRN, they got reference from NCC, and they get reference from ESMO. See, let's see the next question. And if I got this marked, you can directly see the answer. You can see that in this case they given the reference from the NICE guidelines, and for the MRCP NICE guidelines are most perfect, and you can go through this link and get the guidance for. So if every question will give you some reference, and you can read through this to increase your knowledge. So I think the study PRN could be a very good thing for the MRCP SCE exam. So last but not the least, the MRCP SCE medical oncology is not easy. It's valuable exam, as it cost around 825 pound, or around 1,42,000 taka. So before giving exam in September 11, 2025, prepare early and study. PRN could be your good solve. Thank you all.